Hi, welcome to the July MAP update training. This month's topic is long-term care options and financing. So when we're talking about our MAP clients, when we're helping our MAP clients, one of the things that comes up a lot of times when we're talking about Medicare coverage or maybe helping a Medicaid client is this idea of long-term care. So my expectations, the expectations of this program aren't really to be able to help with the details of long-term care, but be able, when they start having that conversation that looks like it's a long-term care conversation, that, you know, we can empathize with what's going on, help them to the extent of our training, but then be able to kind of refer them on to somebody else who can help. So I wanted to kind of define what long-term care is. Long-term care is actually different from medical care, and I even say this because when people think Medicare, because Medicare is for older adults and persons with disabilities, there's this assumption that long-term care is included in Medicare, and that simply isn't true. Medicare covers medically necessary care, and so long-term care is something different. So long-term care is designed to not help, is designed to help people live as they are, and not to actually improve a health condition. So with long-term care, we're just trying to keep people independent and safe, and we're helping with things called activities of daily living, and those are activities like bathing and going to the bathroom and feeding oneself and getting up and down out of a chair and you know, transferring from a bed to a wheelchair, those types of things. And long-term care can be due to a physical illness, but it also can be due to a cognitive illness, such as Alzheimer's or dementia. So long-term care is actually quite costly. There's a website, longtermcare.gov. It's a very, very excellent resource that is put together by Centers for Medicare and Medicaid Services. So I encourage you, if you're interested in long-term care, to check out this website. But if you're helping people, as a caregiver that's internet savvy, this website might be of a great resource to them as well. And so longtermcare.gov actually put together what some of the average costs of long-term care were. And so it's 2010 information that we're going to be viewing here, but the costs are pretty similar to today's cost. So if somebody were to go into a semi-private room at a nursing home, the average cost of that was $205 per day. We hear a lot of times that people want to go to an assisted living facility where they can have their own apartment, but receive services there. And there's different types of assisted living. Some are licensed, some are unlicensed. But the average cost of an assisted living facility for a one-bedroom unit is $3,293. So assisted living for many people is unaffordable. Likewise, home health care aides, if you were to bring in help, you know, in somebody's home, that could be quite costly too. So if somebody wants a home health aide to help them with some of those long-term care services, it would be $21 an hour on average. That's $19 on average for somebody to help with homemaker services, which is cleaning and cooking and those types of things. Adult daycare is another option that's available to people, and that's usually for somebody with some kind of cognitive disorder. And adult daycare keeps the loved one engaged in activities. Sometimes they do art therapy or music therapy, feeds them lunch. There might be a rest time as well. And that's $67 per day on average. So as you can see, some of these costs can be add up over time. So who pays for long-term care? Well, 40% of long-term care expenditures are actually paid for through Medicaid dollars. This could either be nursing home Medicaid or Medicaid in the community. Coming in second, 21% of long-term care costs are paid for by Medicare's skilled nursing facility benefits. So even though skilled nursing facility benefit is a medical service, because it is in a nursing facility, and sometimes a skilled nursing facility stay can lead to long-term care, they include it in the study. Coming in third would be other public and private resources that pay for long-term care costs. This may be something like VA benefits. This could also be if there's an employer benefit that might cover long-term care, could be in that category as well. 15% of long-term care costs are paid for either through the individual savings, so out-of-pocket by the individual, or by the family member. And then finally, long-term care insurance covers 7% of long-term care costs. So we're going to talk about each of these things in a little bit more detail. The first category we're going to talk about is Medicare and their long-term care benefits. Now, Medicare is a health insurance. It's not a long-term care insurance. And so, technically speaking, Medicare does not cover long-term care. But there are a few services that Medicare covers that somehow works with long-term care. So Medicare covers medically necessary care, and it's focused on acute care, such as doctor's visits, prescriptions, hospital stays. There are short-term services for conditions that are expected to improve, such as physical therapy. With any of Medicare services, it's treating a condition and there's an end in sight. There's a specific goal in mind. Now, with that said, though, Medicare can play a role in long-term care coordination in one of two ways. The first way is that sometimes people may receive a Medicare service, and then while they're receiving that Medicare service, they may deteriorate and need long-term care. For example, if somebody goes into the hospital and then goes into a skilled nursing facility, and while they're at the skilled nursing facility, they decline, they just are sick and frail, then at that point, then they may need to go from that skilled nursing facility Medicare benefit to a long-term care nursing home benefit. So that's one way that Medicare can play a role in long-term care coordination. The second way is that sometimes you can use your Medicare health benefit in tandem with a long-term care benefit from somewhere else. So, for example, if somebody is getting Medicare home health care and they're getting home health care because of a medical necessity, they might be able to arrange their private pay long-term care services around that Medicare benefit to kind of come up with a game plan that is comprehensive. So those are the two ways that Medicare can play a role in long-term care coordination. Now, when we're talking about the long-term care services under Medicare, again, They're not really long-term care services. They're really health services, but they play a part in this discussion, so long-term care. We're really talking about 3 services: skilled nursing facility care, home health care, and hospice. With skilled nursing facility care, we're talking about nursing home care. And in the nursing home, there are 2 types of care. There's that skilled care or custodial care. The skilled care is what Medicare pays, and that is when health care is given, or when skilled nursing care is given, or when physical therapy or some kind of rehab is given. And so you have skilled services that are needed to manage, observe, and evaluate care. And this can be provided at the hospital or a skilled nursing facility. So skilled care, that's what Medicare pays. Custodial care, Medicare does not pay for this. Custodial care in the nursing home is really it's the care that helps with the activities of daily living, like getting into or out of bed, eating, bathing, dressing, using the bathroom. Those things that people need to do every day. And so if people need help with those activities, that's a custodial care benefit, which is a long-term care benefit. And Medicare does not pay for that. Now, what's covered by Medicare skilled nursing facility benefit? Well, Medicare pays up to 100 days per benefit period. The first 20 days, Medicare pays at 100%. The remaining 80 days, there is a per-day copayment. These days are only paid for if the person needs that care. So if I get better in a nursing home after 10 days, who wants to stay in a nursing home longer than we want? Then we absolutely have to. So if I get better after 10 days in a skilled nursing facility, then I would leave earlier than that 100 days. Likewise, if I become too frail and I need more care and it becomes a long-term care situation, there may be a conversation with the nursing home talking about maybe Medicare no longer paying and having to go toward a Medicaid benefit or having somebody else with a long-term care insurance activated. Medicare covers medically necessary care, a semi-private room, and meals. It will not cover a private room unless that private room is medically necessary. It also does not cover custodial care. In order to qualify for skilled nursing facility coverage under Medicare, a person has to have a 3-day hospital stay prior to the SNF admission. So this means that they have to be admitted in the hospital. They cannot be held under observation for 3 days. And that's a really hot topic right now. The skilled nursing facility stay must be related to the condition for that the hospitalization occurred. So they have to be the same thing. So the neat thing is that the admission to a skilled nursing facility must occur within 30 days of a hospitalization. And you know, what that means is that a person does not have to be transferred directly from the hospital to the skilled nursing facility. Sometimes people want to be discharged home and they want to try to see if they can manage. And if that's their choice, that's fine. If it doesn't work out and they have to go back to a skilled nursing facility, they can, as long as they do so within 30 days of that hospitalization. So that's the skilled nursing facility benefit. Another benefit that kind of is used in that long-term care discussion is Medicare coverage of home health care. Home health care is covered both by Medicare Part A and Part B. The difference is Part A covers home health care after a hospitalization. Part B covers it any other time. The thing with home health care is that a person needs to be homebound. So it's a little bit easier to certify for home health care under Part A, but if a person is seeing a visiting physician, Medicare Part B, getting Medicare Part B to cover home health care is completely doable, especially if somebody is under the care of a visiting physician. So Medicare covers a limited number of days for home health care, and they approve 60 days per episode. So that doesn't mean that somebody's going to get 60 days of care. What that means is that they approved up to 60 days per episode, and within that 60 days, the home health care agency is given a bucket of money based on level of acuity and what's going on with that person and what they may need. And they have to try to come up with a game plan that provides the services that the person needs at the lowest cost. So what somebody would typically see is the home health care agency may come out 3 times a week. Maybe the nurse only comes out once a week and an aide comes out the other 2. It's going to vary depending on what's going on with that person and the company. But for Medicare, to cover, a doctor has to certify that it's medically necessary. Now, if that person, if that 60 days initial approval lapses and that person still needs care, the doctor can recertify that more home health care is medically necessary. It's somewhat hard to do, and sometimes it requires a conversation with the doctor and the home health care company, but it's completely doable. Now, for home health care, there's no copayment. Medicare covers at 100%, except for durable medical equipment. There's a 20% copay for durable medical equipment. So if somebody needs a hospital bed or a walker or a wheelchair, that would all be a 20% copayment. The home health care benefit under Medicare covers skilled care, and that's part-time intermittent skilled care. So it wouldn't be 24-hour nursing. It would be somebody to come in a few times a week, a few hours a week. It also covers a home health aide to help for personal care or other care related to that condition. It covers medical supplies like wound dressing, but it does not cover 24-hour care, meal delivery, or homemaker services. It also does not cover personal care that's unrelated to the thing that's being treated. So if I needed help showering because I'm getting home care for my new hip that I got a hip replacement on, that would be covered. But if I had a hip replacement and I shower just fine because of that, but the reason why I need help showering is because of a torn rotator cuff, and I'm not getting treatment for that under home care, then Medicare is not going to pay for it because it's unrelated to the thing I'm being treated for. So that's the home health care benefit. The other benefit that sometimes overlaps into that long-term care conversation is hospice. So Medicare covers hospice, and hospice is care for the end of life. So the idea with hospice is that they're not treating any medical conditions, they're just trying to make people comfortable during their last days. This trips people up a lot because there are some people that are certified hospice that still want to receive their maintenance drugs and get care to try to get better. And that's not what it's designed for. It's designed to make somebody comfortable during their last days. So there's an unlimited number of days that Medicare covers. And really, in order to qualify, the person has to be given a diagnosis of 6 months to live or less. They have to be given that prognosis. Now, if a person outlives the 6 months life expectancy, the doctor can certainly recertify that the person's still terminally ill, and the person can still receive hospice even after that 6 months. There's no co-payment for hospice services. However, there's a small co-payment for the hospice drugs and for respite care. So Medicare covers for hospice, it covers medical equipment, the drugs for symptom control and pain relief. There's a small co-payment for that. It covers hospice aid and homemaker services, grief and loss counseling for the patient and family, long-term inpatient care for pain and symptom management. Also, it covers short-term inpatient care for pain and symptom management. It also covers short-term respite care up to 5 days per visit. And that respite care would be to give the family member a break. What's not covered by Medicare for hospice are treatment or drugs to cure a terminal illness. If a person wants to be cured, hospice is not for them. It does not cover room and board. So if somebody wants to receive hospice at a hospice facility, Medicare will cover the hospice services, but they would have to figure out some other source of payment for the room and board. And that might be Medicaid, or it could be long-term care insurance, or it could be somebody's own private finances. Also, hospice does not cover medical care unless it's arranged by the hospice team or unrelated to the terminal illness. So that's Medicare coverage of these benefits that might be considered long-term care. The next category of long-term care payment sources would be Veterans Administration. So in order to have VA benefits, a person has to be enrolled in the VA system. And so in order to qualify for VA benefits, a person has to have served active duty and discharged under conditions other than dishonorable as a veteran. They have to have served during wartime. So that's what they mean by active duty. But it doesn't mean that the person actually had to have been deployed overseas to a combat zone, because really when you're in the armed services, you just follow orders. You don't really have a choice on where you serve. You serve where you're told to serve. So for that reason, it doesn't matter if a person was serving here stateside, or if they were deployed to an active combat zone, or if they were somewhere else altogether. As long as it was during an active war or an active conflict, they would qualify for veterans benefits. And then they would have been discharged under conditions other than dishonorable. So we could have had a general discharge, a medical discharge, an honorable discharge. Those are all fine. But people who are dishonorably discharged are out of luck as far as VA goes. The VA actually encourages all veterans to apply for benefits to determine their enrollment eligibility. So, it's better just, even if somebody doesn't think they would qualify for much, it's better just to go through that process and get certified for whatever they're going to get certified for. And so they know, because, what sometimes happens all too often is people wait till they're sick and in crisis, and when they absolutely need something in order to kind of go through this VA eligibility thing, and that could take several months in order to get. So the sooner somebody does it, the better. Now, under the VA, they can qualify for long-term care benefits as a health benefit or as a pension benefit. So there are two health benefits that cover long-term care services. There's home and community-based services, and then there's nursing home services. The home and community-based services are part of the VA medical benefits package. All enrolled veterans are eligible for these services, but in order to get the service, there has to be a clinical need for it, and the service has to be available in the location. Also, some of these services can be prioritized based on the level of VA service-connected disability. And so some of the standard benefits under the home and community-based service package include geriatric evaluation to assess somebody's needs and create a care plan, adult daycare, respite care, and skilled home health care. The other health benefit that's a long-term care benefit through the VA is nursing home care and residential setting care. For the residential setting care, the VA does not pay for room and board in residential settings, and this could be at an assisted living, an adult foster care home, an adult family home. But the VA might be able to help pay for some of the services while they're in those settings. So that's what the residential setting benefit can help with, is some of those services at an assisted living. The VA does cover the nursing home care. They have to meet medical eligibility in order to be in a nursing home, so a person has to be frail enough for nursing home care. Also, things that may determine somebody's eligibility would be their service-connected status and their income as well. The VA also has long-term care benefits under their pension benefit, and really the most common benefit that we hear of through the VA is this aid and attendance allowance. This is part of the VA pension benefit, and the aid and attendance would give somebody extra money in their pension to help cover some of those services that somebody would need in their home. So if they need long-term care services and they need, help paying transportation or help paying for somebody to help bathe them, the VA can help. So the criteria to qualify would be that somebody would need the help of another person for everyday personal care needs, or they have to be bedridden, or they have to live in a nursing home, or they have to have poor eyesight. And so once they get approved, then the VA would help pay for the services. They get extra money in their pension to help pay for the services that they need. The other pension benefit is the housebound allowance. Again, this is also a pension benefit, and it will give them extra money from the VA if the person is significantly restricted to the house because of a permanent disability. And so the housebound allowances can again be used to help pay for services that somebody needs. Now, beyond that, the VA can be a very, very tricky system unto its own. And there are agencies that can help with that. The Department of Veterans Affairs has some excellent information on their website. We also have a 1-800 number people can call. Also, each county has a local veterans office. It's part of the county government. And these local offices can help people apply for the benefits. They can help get them their paperwork to show that they served, the discharge papers. They can help them with state benefits too. They're very, very helpful as far as all of that information. And then beyond that, somebody may prefer to receive help at VFW Hall or an American Legion Hall. And those agencies can also help with applying for veterans benefits. The next payer of long-term care is long-term care insurance. We're just going to give you kind of like long-term care insurance in a nutshell. The August training is going to have more in-depth information on long-term care. So long-term care insurance isn't for everybody. A person should not get long-term care insurance if they can't afford the monthly premiums. long-term care insurance is designed to help protect people's finances. So if somebody does not have many assets, a person is not going to want long-term care insurance. If their only source of income is Social Security, they don't want long-term care insurance. If somebody is having trouble making ends meet or is on Medicaid, they definitely don't need long-term care insurance. Somebody who might want long-term care insurance is if they have a lot of assets or a great income. If they want to protect some of their assets so that, you know, not all of their nest egg is going to long-term care. If they can afford the insurance premiums, including possible premium increases without a problem. Long-term care insurance companies will increase their premiums as somebody gets older and each year. So we're not just talking about cost of inflation increases. We're also talking as the person gets older, their premiums are going to increase significantly. And then if somebody doesn't want the support of others and wants to be just kind of independent with how they deal with their long-term care, they may want long-term care insurance. And if they want to choose where they receive care, that long-term care insurance might be the way to go. So with long-term care insurance, every policy is different. They're not standardized. But they can cover care in a nursing home. They can cover home health care, respite care, hospice, care in a home, care at a facility, care at an adult daycare center, care in other community facilities. They can cover any of these, but what it actually covers depends on how that policy is written. There are some policies that cover all of them. There are some policies that only cover a couple of these. So it's important for the person to read their policy. A person can get long-term care insurance through an insurance agent or an insurance company. They can get it through an employer. Some employers offer long-term care insurance as an option. Alumni associations or trade group associations sometimes have long-term care insurance through those entities. There are some continuing care retirement communities and those are those complexes that have like a nursing home on site and assisted living on site and then apartments on site. There's some of those complexes that have long-term care insurance that somebody can purchase when they enter into one of those facilities. Some life insurances have a long-term care insurance rider. Some annuities can be used to fund long-term care. Then there are these partnership policies, which is a partnership between a long-term care insurance company and Medicaid. Right now, Michigan does not have these, but we're putting in the groundwork right now. So they're starting to meet and come up with a plan to develop these partnership policies in Michigan. So stay tuned. Maybe next year they'll have something. Michigan will have a partnership policy, but right now we don't. With long-term care insurance, a person can choose a tax-qualified policy or a non-tax-qualified policy. If somebody gets a tax-qualified plan, there's some financial incentives. So a person can deduct the premium from their taxes. They can deduct a portion of their medical expenses from the taxes. So there's some benefits in getting into one of these plans. The downside with them is that there are these tax-qualified plans are stricter with benefit triggers. Long-term care policies have long-term care policies have different options in their benefits. So one option is maximum benefit limit. And what that is through the lifetime of that policy, the policy may only pay a certain amount of benefit. For example, The maximum benefit limit for the lifetime of a policy may be $1 million. And so once a person reaches $1 million in long-term care costs that the policy pays out, then they've depleted that policy. Or it might be worded in years. They may have a 5-year maximum benefit limit. That's going to depend on the policy. And again, the more generous the policy, the more it's going to cost somebody to have. Another policy option is a daily, weekly, or monthly benefit limit, and that would be, you know, that it will only pay X amount per day or per month or per week. So, and it's going to be dependent on type of service. So they may have a $100 per day benefit limit on nursing home care, meaning that the policy will only pay out $100 per day for nursing home care. And the person would have to pay the rest. Or there might be a $20 per day benefit limit on home health care. So it would just depend on how that policy is written. It's going to vary from each one policy to the next. Each policy will have benefit triggers, and what those are is what triggers that long-term care insurance policy to start paying benefits. And so the most common benefit trigger are ADL deficiencies. So if somebody has 2 or more ADL deficiencies, they might be able to get their long-term care if that's a benefit trigger. Sometimes cognitive impairment is a benefit trigger, or a certificate of medical necessity, prior authorization, those are other benefit triggers. Long-term care insurances also have an elimination period, and what that is it's the period that a person needs to pay out of pocket before the insurance company begins to pay. So it's kind of like a deductible. So if the elimination period is 20 days, that would mean that once the benefit is triggered, the person would pay the first 20 days out of long-term care out of their own pocket before the insurance company would kick in there and start paying. Also, another policy option is inflation protection. And what that is it's protection in the policy to help keep the benefits congruent with what things actually cost. So if I buy my long-term care insurance policy in 1990, well, things cost a lot different back then. I would want to make sure I have an inflation protection to make sure that if I needed long-term care insurance now, that the policy that I've bought and continued to pay for since 1990 would pay based on today's rates, not 1990s rates. So if a policy has inflation protection, those benefits would be adjusted based on inflation each year. So that's long-term care insurance in a nutshell. Again, August update trainings may have more information on that. So if you are interested in long-term care insurance, stay tuned until the next training. The next long-term care program is Medicaid. Medicaid is a program. It's a state and federal partnership that helps with medical costs for low-income folks. Medicaid also has a long-term care program too. Every state's Medicaid program is a little bit different, so just because somebody qualifies in Michigan doesn't mean that they're going to qualify in another state. So if somebody is receiving services in another state and they come to Michigan, they would actually have to reapply for Medicaid. Now, there are a bunch of medical services that Medicaid covers. We're not going to really talk about those today. We are going to focus on Medicaid's long-term care services. And so these are home health services, programs for all-inclusive care for the elderly called PACE, Michigan's Home and Community-Based Waiver Program, which is called My Choice Medicaid Waiver, and then finally custodial care in the nursing home. Medicaid's home health services, those are people who are on community Medicaid and they're at 100% of poverty level and they're getting the community Medicaid health insurance. But they also need help performing activities of daily living. Well, if that's the case, they can get this home help service, and it provides the person a monthly stipend where they can hire somebody to help them perform some of the tasks that they need help with. The great thing about home help is that a person can go to an agency if they want to, but they don't have to. They can hire a family member, a friend, a neighbor, somebody they know from church. They can use an informal caregiver, or they can use an agency. And this is great because the monthly stipend that Medicaid's home help services is typically not a lot of money. It depends on that level of acuity, but it might be a few $100s on the generous end of things. So if a person can employ an informal caregiver like a family member or a friend, then they can maximize those services. And the services that are included are personal care like housekeeping, meal preparation, shopping, and help with taking medication. The next Medicaid program is home health services. So the person must be on community Medicaid, Medicaid AD care, and that home health services will help pay for medically necessary care in the home that's not already paid for by Medicare. So this is not a frequently used benefit because most things are covered by Medicare. The next program that is covered by Medicaid for long-term care is PACE. In order to qualify for PACE, the person has to be 55 years old or over. They have to live in a PACE service area. We have, in the 6 counties that we serve, 2 PACE programs that serve us. We have the Huron Valley PACE in Ypsilanti that covers all of Washtenaw County, parts of Monroe County, parts of Wayne County, parts of Livingston, and a little bit of Oakland. We also have Centers for Senior Independence PACE, which is located in Detroit, and that PACE covers the southern portion of Oakland County and the southern portion of Macomb County. In order to be eligible for PACE, the person has to be medically eligible for nursing home care. And this is a partnership between Medicare and Medicaid where the PACE organization really coordinates all the health care, all the home care, all those services somebody might need is coordinated under that PACE program, including that medical care. So it's more of a clinical benefit that also oversees the long-term care benefit. Another Medicaid program that covers long-term care is Home and Community-Based Services, also called My Choice Medicaid Waiver Program. This provides in-home services for people who are at risk of nursing home placement. There is an income criteria and an asset criteria. Income for an individual must be $2,199. If the person is married, we do not count the spouse's income for this program. They do look at the assets, though. For an individual, it's $2,000 or less in assets. For a married couple, they do look at both couples' assets, but there's some protections for the spouse that does not need long-term care. This is a little bit different from the PACE program in that the Medicaid waiver program just coordinates those long-term care services in the home. So if a person needs help with housekeeping or help with bathing or dressing, or if they need transportation, you know, it would coordinate all of those types of services. This is more of a social model. It's less of a clinical model. So the difference between PACE and home and community-based services is PACE has a clinical component where it does coordinate some of those medical benefits, whereas My Choice just focuses on the long-term care benefits. And that's coordinated through a nurse or a social worker, so they do understand that medical component, and they try to work with the medical component, but the medical component is not as closely integrated as with PACE. In Michigan, the My Choice Medicaid Waiver Program is administered by waiver agents, and in our service area, the Area Agency on Aging 1B and the Macomb Oakland Regional Center are both the waiver agents for this area. Finally, nursing home care is also covered by Medicaid. Medicaid will pay for room and board and services in a nursing home. The person has to meet the nursing facility level of care determination, so they have to be medically eligible for nursing home care. The income criteria is simply that the person cannot afford to privately pay for nursing home. Asset is $2,000 or less for an individual, and if somebody's married, there's protections for the community spouse. So the community spouse will have an income allowance where there's some income that's protected, where the community spouse would get to keep a certain amount of dollars to maintain the home and be able to live and pay for food and rent and all that. There's also a protected spousal amount for assets, and that would be that the community spouse is allowed to keep the greater of $23,844 or half the assets up to $119,220. So there are some protections for the community spouse. So that kind of rounds out the discussions of long-term care. That there's several different care settings. There's several different options on who pays. Sometimes people ask us on how do we plan for long-term care, or how do we choose a care provider? Well, Medicare.gov has some great tools. They have a long-term care planning tool that's right on their website. They also have a nursing home compare tool, which is great. So if somebody is looking to go into a nursing home and needs help finding one, and how do you know what to look at? Well, this gives some great information about some quality rankings, the insurances of that, but whether or not the nursing home accepts Medicare or Medicaid. And then it lists also the health reports from the health inspection, the fire inspection information. So it's some really great information. There's also a home health care compare tool, which again will give you some of the quality metrics for home health care agencies. And then finally, Medicare.gov through its MyMedicare.gov portal. A person can sign up to receive real-time information on their records. So if somebody is pretty frail and needs a caregiver to help manage some of that, some of their Medicare information, that MyMedicare.gov is a great resource. The person would have to agree to allow the caregiver access, but if that's the case, it's just really helpful for those caregivers that are internet savvy. Now, I talked about it at the beginning of this, that you're not expected to be long-term care experts at all. I gave you just a little bit of information to be able to have a little bit of a conversation with somebody as they're coming to you, but the conversation goes sideways into this conversation of long-term care. But really, you can refer out. So if somebody needs help, you can give them the MMAP 1-800 number. It's going to get routed to the local area agency on aging. So the area agencies on aging, their staff has the training to help with these answers. So if somebody needs to have that conversation, giving them that MMAP number is absolutely appropriate, because then the resource specialists who handle the call can help answer those questions. Also, Elder Law of Michigan is a very, very great resource. If somebody's looking to start doing this planning for long-term care, and maybe they have some money, but not a lot of money, and they're wanting to know if they should be giving their money away to charity so they can qualify for Medicaid. Spoiler alert, they should never do that, because that could get them in trouble. Or if they want to, if they start talking about investing or buying long-term care insurance or annuities or anything like that, the absolute best place to have them go is Elder Law of Michigan or an elder care attorney. And they, they have some assets, that they're looking to protect, then it's worth that investment to speak with a lawyer and have things done right. Well, that concludes today's training. Thank you so much for taking the time. If you are viewing this via webinar, please let your site coordinator know that you saw this so that they can give you credit for attending this. Thank you so much, and have a great day.